In this video, I'm going to discuss the number one reason why your Medicare costs are more than you expect, maybe even a lot more. Coming up next on Holy Schmidt.
Holy Schmidt!
One of the biggest complaints we hear on this channel is that Medicare costs are out of control for some people. Going into Medicare, what they expect is a Part B premium, a Medicare plan premium, a Medigap plan or Medicare Advantage plan, and maybe a deductible, and that's it. And even if you do everything right, Medicare isn't exempt from increases. The Part B premium, for example, went up $17.90 from 2025 to 2026. Is it the end of the world? No. Is it irritating? Absolutely. It's part of a broader picture that people going into retirement or in retirement are feeling. Things like the cost of living adjustment being modest and their actual lifestyle or not, or not being able to work until full retirement age and therefore having to give back part of the Social Security payment. You get the point. All of these fees reduce income for retirees, and oftentimes they're just not budgeted for because they're small fees that add up when you add them up. But these fees that we just talked about aren't the ones that drive up the cost of Medicare. In fact, there are what I call the four horsemen of Medicare fees, with number one being a clear winner, and that's not a good thing. And we're going to cover all four of these off now, starting with number four and working our way down to number one. Number four, out-of-pocket costs. 13% of Medicare recipients are on original Medicare and nothing else. That means that they have Part A and they have Part B, and they don't have a Medigap plan or a Medicare Advantage plan. And this group has out-of-pocket costs. As you can see from the chart, Medicare Part A has a zero premium cost for most people anyway, but it has deductibles and coinsurance. Medicare Part A covers inpatient hospital care, skilled nursing facility care, hospice care, and some home health care. There's generally not a premium for Part A if you have 10 years of work history or more, but there is a deductible and there is coinsurance. Medicare Part B covers doctor services, outpatient care, home health care, durable medical equipment, mental health services, ambulance services, and preventative services. There's a premium for Medicare Part B, a deductible per year, and coinsurance, typically 20% of the Medicare approved amount for most retirees after the deductible. Because of the risks associated with not having everything covered, most people have either a Medigap plan or a Medicare Advantage plan. A Medigap plan is private insurance that works alongside original Medicare to pay some or all of the deductibles, coinsurance, and copays that Medicare Part A and Part B do not cover. Then there's Medicare Part D, which is a prescription drug plan offered by private insurers that help pay for the cost of medications you take home, with costs based on the drugs you use, the plan's formulary, and your income. The alternative is a Medicare Advantage plan. A Medicare Advantage plan, also called Part C, is a private health plan that replaces original Medicare, bundles Parts A and B, and usually D too, and delivers medical benefits through a network with its own rules, costs, and annual out-of-pocket maximum. It looks a lot like an HMO or a PPO, and it's in a very specific region, often county for many of them. Now, those are the costs that people expect, but what they don't expect is what happens with some of these insurance carriers. Some raise costs every year, significantly in some cases. Some just leave the area, or at the very least, they change the coverage on their plan. They have different providers. Some change the formulary so that the important drugs that are covered are no longer covered. All of this in order to cut costs. And this affects people every year. Speaking of Medicare, gang, Medicare can be confusing. Ask any 65-year-old and they will tell you that this is true. Even after hours of work choosing just the right plan, oftentimes they get it wrong, costing them hundreds of dollars a year or more in additional costs. On this channel, we have 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is the only national Medicare advisor that recommends every plan. They're totally free to you. They save their clients an average of $1,100 per year, and they won't push you into a plan that you don't want. If this is of interest to you, if you're getting ready to turn 65 or you just have questions about Medicare, give them a call at 440-703-1224 to see if they can help. There are some costs that just aren't covered. For example, long-term care. The majority of long-term care costs just aren't covered. It feels like it should be because that's a significant cost that a lot of people face into when they retire, but it's not part of the Medicare offering. And there are many like that with a Medigap plan. Routine dental exams and cleanings, fillings, crowns, root canals, dentures and denture fittings, dental implants and oral surgery, vision care, routine eye exams aren't covered, eyeglasses aren't covered, LASIK and other elective vision correction, most vision hardware upgrades, hearing care, hearing exams for fitting hearing aids, the actual hearing aids themselves, repairs, batteries and replacements, alternative and elective treatments, acupuncture, chiropractic care beyond limited spinal manipulation, massage therapy, and other holistic treatments. And then still others have limits, for example, physical therapy and experimental or non-approved treatments. There are also medical equipment exclusions, care outside of the United States exclusions, and transportation. Now, a Medicare Advantage plan can cover some of this, but you give up a lot with a Medicare Advantage plan that you don't need to give up with a Medigap plan. It's usually an HMO or PPO style plan, and the coverage area is very limited. So you have to have care within a state, sometimes it's even within a county. The next one is missing your initial enrollment period deadline. And that's 3 months before your 65th birthday, the month that you turn 65, and 3 months after the month that you turn 65. The exception is if your birthday is on the first of the month, then they shift the calendar to 1 month earlier. Everything moves back 1 month earlier. And it's done really for administrative reasons. It's just easier to do it this way. Missing your Medicare initial enrollment period triggers 2 different penalties, at least one of which is permanent. The first is a Part D late enrollment penalty. If you don't sign up for Medicare Part B during your initial enrollment period and you're not on an employer plan with 20 plus employees in the company, either yours or your spouse's, then you could be faced with significant penalties. The penalty that you pay is 10% more on your Medicare Part B premium for every 12 months that you're late. So if you wait 3 years past age 65 to enroll and you don't work for a qualifying employer and have qualifying coverage, or your spouse doesn't have qualifying coverage depending on your situation, if you wait 36 months, your payment can go up an additional 30% for life. That's permanent. And for your prescription drug coverage, Part D, there's also a late enrollment period. If you go 63 days or more without creditable drug coverage, then you will likely be facing a penalty. What's the penalty? It's 1% for every month that you were late. So if you were late 12 months, well, that's 12% on top of the normal Part D costs. It adds to your Part D premium and it lasts for life. And just to be super clear on this last point, if you or your spouse is working for an employer and they have 20 employees or more, it needs to be creditable, meaning the coverage must be from a current employer, yours or your spouse's. Retiree health insurance coverage does not count. COBRA does not count. And a large group plan only counts while you're working for that employer. The fact is most people don't miss this. It's ingrained in most people, and people get bombarded with everything from ads to phone calls as they approach age 65. But it does happen. There isn't a lot of current data on this, but there was a report done many years ago that suggested 12% of people actually miss it. And in that report, the average miss was 3 years, meaning that they had a 30% increase to the cost of their Medicare Part B premium. Now, what's the number one reason Medicare ends up costing people more than expected? Can you guess? IRMAA surcharges. An IRMAA surcharge is an increase in your Part B premium based on income. If you exceed certain thresholds, your IRMAA surcharge increases. And the reason that this is a problem is that people want more income in their retirement. And so therefore, if people are striving for more income, they're more likely to have an IRMAA surcharge. The other reason is that there are a series of things that can happen that have one-off gains in your life, and those one-off gains trigger an IRMAA surcharge. It happens all of the time, and these are big costs. IRMAA is calculated by looking back 24 months, and so your IRMAA surcharge for 2026 is based on your 2024 income, your modified adjusted gross income for 2024. Now, why wouldn't they just use last year's income like your tax return? Well, your IRMAA surcharge needs to be automatic. When you file your tax return, it gets reviewed and then eventually it gets approved. If you owe them money, hopefully you send it in when you send in your tax return. The other reason is that Medicare rates get set in advance. And it's a lot easier to set rates in advance if you have a pretty good picture of what the Part B premiums and the Part B surcharges are going to look like simply by looking up some information on the computer. The good news is that the IRMAA surcharge isn't permanent by default. It's a 2-year look back, and it only exists for 1 year, unless you have additional income beyond the limits the following year, and so forth and so on. And the Part B total monthly premiums look like this. For individuals that have $109,000 or less, or couples that have $218,000 or less, the total Part B premium is $202.90 per person. There's no surcharge. If an individual has $109,001 to $137,000, or $218,001 to $274,000, the total Part B premium goes up to $284.10. And you can see from this chart that it continues to go up all the way up to $500,000 plus for an individual, or $750,000 plus for a couple filing jointly, to $689.90 per month per person. So the Part B IRMAA surcharge itself ranges from $81.20 per month all the way up to $487 per month per person, depending on the modified adjusted gross income on the tax return. Now, if you have a Part D drug plan, there's also an IRMAA surcharge on that. Up to $109,000 or $218,000 single or married filing jointly, respectively, there's no surcharge. And you can see on this schedule that it goes up from there. And if you review each line item, you see that it caps off again at the same thresholds, $500,000 for an individual or $750,000 for a couple, and the surcharge is $91 per month per person, depending on the income level. Now, some of you at this point might be getting a little bit glassy-eyed and saying, why is he telling me this? This doesn't apply to me. Well, it could, and it probably will, depending on your specific circumstance. But let me tell you some situations that may actually apply to you, and you wouldn't see these coming. The first is that it could come from a Roth conversion. Now, most people won't convert all at one time because they don't want to push into the highest tax bracket. That sort of defeats the purpose of converting to a Roth. You want to keep your taxable amount as low as possible when you are doing a Roth conversion. But it doesn't mean that you're keeping it so low that you won't trigger IRMAA surcharges. And if you're doing this over a series of years, you could be facing IRMAA surcharges for years. And what if you just sell funds from your IRA or your 401k to live? A lot of people do that. Well, again, you could trigger an IRMAA surcharge. What if you sell your house? I have a whole video on this. In fact, I'll put a link to that video at the end about how you could have a $13,000 plus penalty if you sell your home and you have a significant amount of capital gains. What if you have a one-off withdrawal from your IRA to pay for something like a wedding? You guessed it. IRMAA surcharge is possible. There are enough one-off situations like this that happen for you to know that there's a possibility of an IRMAA surcharge. Just because it's one-off doesn't mean that you're not going to pay an IRMAA surcharge. Just because it's not recurring income doesn't mean that you're not going to pay an IRMAA surcharge. Now, since this is income from 2 years ago and not this year, Medicare acknowledges that this isn't a perfect match. You might not have even been on Medicare 2 years ago, and so you're paying an IRMAA surcharge on something that you didn't actually use 2 years ago in a lot of cases. And the government acknowledges this. So they have 8 exceptions to this surcharge. And basically these exceptions are life events that happen often to reduce your income right after that event. For example, if you retire from work or work retires you, work stoppage. If your work hours were reduced, if your spouse passed away, if you got married, if you got divorced, if you lost income producing property due to something that was out of your control, like a natural disaster, if you have a loss or reduction in pension income or an employer-related settlement coming to an end. These are all events where the government will consider reducing or eliminating your IRMAA surcharge, but you need to file for the appeal using Form SSA 44. On the form, you check the box that says that this is a life-changing event. You enter the estimate of your reduced income and you provide some level of proof. The fact is, this isn't that complicated, but you do need to be accurate because it could backfire later if you're not accurate. If you like this video, check out that video, 5 big changes to Social Security in 2026. Also, if you have questions about Medicare, don't forget to give our partner chapter a call at 440-703-1224 to see if they can help. This is Jeff Schmidt, and I will see you in that video right there.